That's very sad, you know, and Mr. Cummings said he may be the poster child for greed and unfair pricing, and it's a very serious matter. And while he's the focus of attention and he's the villain, we have a lot of blame to go around. The pricing for drugs is, from all of these companies, has skyrocketed. Some of the information I have is prices have more than doubled for 60 drugs in the past year. And then a survey of about 3,000 brand name prescription drugs found that prices have more than doubled for 60, and at least quadrupled for 20 since 2014. Is that correct, Dr. Woodcock?
Excuse me, Congress has not really vested any authority for FDA over
on pricing. Right, we know that.
We do not follow that.
And you said about 88% of the drugs that are consumed out there are generic today?
That are dispensed, say, by pharmacists are generics, that's
Okay.
correct.
And the situation with their pricing, has that increased or decreased? What did you testify to?
The HHS recently released a report that showed for Medicare, about 2/3 of the drugs over the last several years, the generic drugs, decreased. The prices had decreased. But there's a few where prices have increased. So there's a group that has increased. And this may have to do with the amount of competition in those, for those drugs.
And one of the problems is the approval process, and you spoke of getting drugs out there, and you have competition, the price can come down, and there you've made some progress you cited today. Ms. Retzloff, is the company you work for owned by Mr. Shkreli?
He is a shareholder, yes. A shareholder.
Does he own what share, do you know?
I'm not sure what share he owns of the company, but I can check that out.
Well, you described a little bit different scenario on what's been publicized as Daraprin's costs.
Yes.
It's pretty sad that your shareholder would take that attitude. At least you did explain to the committee some of the pricing. But again, there are other companies and drugs, Alkertin A, an 1,860% increase, is that correct? Anyone know? And that's not your drug, is it? So it's another manufacturer who's just as guilty. Maybe not as arrogant, but just as guilty. But millions of Americans depend on medication. I brought mine. And I'm pretty fortunate. I've got coverage, but a lot of people's life depend on it. Mine is not that situation. But what we've seen here is unprecedented arrogance, and what we see is a situation where people who need these drugs are denied these drugs because of pricing and lack of competition. And I think we're going to see more of this because people take advantage of this system. I yield back.
Thank the